September Health and Human Service Committee to order.
Let me just pull it up here.
Bob here.
Bob is on.
Bob, you're up.
Okay, thank you. Two requests today. The first being I'm requesting authorization for the board to renew an agreement with Teresa Holleran. We've been renewing that periodically now for quite a while. She retired, but we're down several social welfare examiners, and with the hiring freeze, haven't really sought to fill those just yet. So, with her expertise and years of experience, we've been able to keep up. She's willing to keep up with her contract. It's a part-time thing. It doesn't exceed a certain number of hours. And so just to keep pace, I'm asking to have that renewed.
Bob, that's paid out of contractual .4?
That is correct.
Okay. I'll move it.
I'll second.
All in favor?
Aye.
Aye.
Opposed? So carried.
My second request, I actually talked over with the folks some budget yesterday. And Chairman Ligonia, you might be familiar with this, but so I have what's known as clerk typist positions in my building, and they sort of, they do a lot of different things, and not the least important of which is they interact a lot with the public as they come in, either for intake or just questions they may have at either of the windows that we have. And we've been down in that position generally. And then we had somebody resign just as COVID was hitting, you might recall, and actually called back and said they'd be willing to come back. But, just with the freeze that came about, we decided, not to look into that at that time. But then we had another clerk typist transfer over to mental health in the last few weeks, which has really left us short. So I brought to Budget and Finance the possibility of bringing this clerk typist who left in March back. I would say this, that since the hiring freeze, we've actually gone down 6 positions and not looked to fill any of them. So we're still ahead of our projected savings from the furlough and from the freeze. And this being a swap of one clerk typist for the next wouldn't affect those numbers at all. But we are really struggling to meet the need for our intake and for the folks that deal with the public, either walk up to the window or in at the lobby. So that's why the request is going out today.
And how did that go at the budget workshop?
If I could just interject, it went fine. I think the fact that Bob had and Ron Campanera concurred that in terms of position control, that DSS was down 6 positions since the start of the year. So, I mean, there's been a significant savings there.
Okay. Any other questions for Bob?
I'll make a motion, we move this.
I second.
Patsy.
I second.
Have this second. All in favor?
Aye.
Aye. Opposed? So carried.
Thank you. That was the extent of my request at this time. I'm going to stay on the line just in case I can help or if there are any questions for me.
Yeah, I have a question. This is Supervisor Sterling. I noticed that foster numbers have gone up significantly.
They have.
Any reason for that?
Well, I'm looking closely at that now. I don't have any true explanation because my preventive services have stayed intact even through COVID. There often are swings, But I did ask my deputy, let's take a look at that because I would prefer, as a very last measure to bring children into care, set aside a moment the expense because it is a great expense, but you really want to do it as a last resort because unity with the family is the top priority, and you do get the best outcomes. I don't have any sociological or environmental explanation for that, but they have gone up this year. I would tell you a couple of the cases, there were several children in a family, so that was a lot. Just a couple of families accounted for a lot of that. Yeah, so that's where we're at, but I'm hoping that we can stabilize that and even reunite these children with their families sooner rather than later.
Okay, thanks.
Any
Thank
other
you.
questions for Bob? Thank you, Bob.
Thank you. I'll stay on the line.
Jack? Who's up?
Jack?
You have to unmute. You have to unmute before you start.
Yes, you do.
Okay, so this first resolution is just correcting account numbers related to that $266,000 we're getting from the CDC to hire a nurse to do ComCare and hire our COVID clerk. So this is just a correction on that resolution.
I'll make a motion.
Second.
Motion.
Second it.
All in favor?
Aye.
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 Opposed? So carried.
Okay, this resolution is about the $95,000 that we got way back in like April. For some reason, we never put a resolution in to accept it. We've been using this for our overtime. We're about 2/3 of the way through. I think we'll make it through to the end of the year unless we get a tremendous spike where we have to put a lot of people back on weekends. But we just never accepted this funding, so that's correcting this.
I'll move it.
Second.
Second.
Supervisor Mussman. All in favor?
Aye.
Aye.
Opposed? So carried.
And I will say that this is one of those things that Tim, who is filling in as our fiscal manager, is uncovering as he digs deeper into the program. So I think we're getting some good stuff resolved. This is a request to be able to not contract, but have an agreement with local town halls and firehouses. When we have a spike in Narcan, if we have a spike in overdoses, we go to that community and we set up the van from Twin County Recovery Services. We hand out Narcan. It's been a very successful thing that we move around the county. This would just formalize the agreement with the various towns, either firehouses or town halls, that we can use their facility to go in there and set up really quickly.
I'll move this. I approved mine last night. It's a good thing to do.
As a leader. Second.
I'll second
Kathy
it.
Eldridge.
Oh, I'm sorry, Kathy.
That's okay. Hi, Matt.
Supervisor Eldridge. All in favor?
Aye.
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 Opposed? So carried.
I just have a quick question, Mr. Chairman. Jack, is that an MOU you're talking about?
I think it depends on what the county attorney wants to do. I mean, MOU is more formal. If that's what they want to do on it, it basically says an agreement here. But if the county attorney wants an MOU, then we'll do an MOU.
Okay.
Okay, so this is the 266. This is just simply accepting the $266,000 through the state for that'll run through June of 2022 to fund those two positions I mentioned earlier. But this is incorrectly stated the account. Did we go backwards? I think we just voted on this one.
We did this one, didn't we?
Yeah. Okay. So this is gratis. So about a year or so ago, we found out from MIS that a software program called Progressa that we had, which is used to track our nurses' time and effort, was being abandoned, was going to be unsupported, and then we needed to find another platform to do that with. We contacted local health departments to find out what other departments were doing with this stuff, because Progresso was a um, uh, pretty much used by a lot of departments with nursing. We found Gratis, which was actually developed by an individual at State Health at Schenectady Health Department with McGinnis, which is a company that does the platform. So it was developed specifically for Schenectady. They are a full service. They also have an environmental health unit. So it does the double duty of supporting our efforts when it comes to logging time and effort into for our grant submissions. Environmental is actually the biggest the biggest problem. They have a platform that's also very slowly being phased out called EHIPS that we have to report all our time and effort in it, and we actually have to maintain a paper in order to report into our grants. We have to maintain a paper system that runs parallel with EHIPS, and it's takes a huge amount of time to do this. And then, of course, April came, and all of a sudden we have to track all our COVID time. So the person who was doing all of this tracking and spending a big chunk of time on it was Tim, who is now our acting fiscal manager, and it just really has become a giant nut for him to overcome. Very difficult for us to overcome. I admit we're a little bit behind on our submissions, and so because this program was literally developed by a local health department, and it's owned by McGinnis, which helped develop the program with Schenectady. It's really tailor made for us. That having been said, it's also any agency out there, any department out there that has to track time and effort, once we buy the license on this, can also use this. So I think it can be useful across other departments. It is $50,000. I recognize that's a big chunk of change in this year of everything being cut back, and we're watching every dollar. We had talked to Ron about putting it all in this year because we're running under budget in the health department. We have various grants that we can put it under that we don't typically spend all our TUPA. We have to track time and effort in there. We don't spend all of our water grant. We have to track time and effort there. So we're able to diffuse that expense out into there and actually use it to spend all of the grant monies that we have under those programs. So the 50,000 seems like a lot of money. We had talked about 25 this year, 25 next year. There is 25 in the budget next year. We certainly can go that route if the committee wants to see it, but we also felt that we could get this out of the way. We do spend money to maintain Progressa. We also there's other QuickBooks is another thing that we use. We can use this program to report under QuickBooks, and it will make us so much more efficient when it comes to reporting our state aid.
So are you saying that you have the revenue to offset the 50,000?
Yes, well, not entirely. We will put under our various grants that we don't always spend all of it. We will spread it out, spread the $50,000 out. Lead, healthy neighborhoods, TUPA, the water grant. We can spread it out under all of those activities. So we will be able to reduce that $50,000 down quite a bit. I don't have a real number for you on that, but as we modify our grant, those grant submissions, we'll be able to spread it out.
Jack, you said this was in the budget for next year?
We put
No, we put 50% in for next year, and he's gonna do 50% this year.
And the
Wow.
50% this year, Ron, would come out of where?
Well, that's gonna come out of his O&M budget. And like he says, he'll try to squeeze that in all these grants he's got to funnel that through and try to get reimbursed the 24,000 for this year and next year. I don't think he'll have a problem doing it because it does oversee a lot of his grants and everything that he's going to be using it for. So it is very easy to cost allocate that towards these grants.
Thank you.
So I have a question, Jack. Is the software programs that we're using now,
do they talk to one another? Is the data easily exportable from the program that we're using now to this new program? And when you talk about number of licenses, typically when you buy a license, it's either a single-use license or a multi-use license. So which is this, a single or multi-use license?
My understanding from Tim is that, and he did speak to McGinnis specifically on that, is other departments can use it. So I think it's a multi-use license. I can confirm that.
I'm sure they can use it, but it's a question of whether or not they use it for an additional fee or whether or not they can use it under this existing umbrella or license. And what about exporting data either into this program or out of the program in the event that we should change software vendors in 2 years?
Well, in terms of the state health department, state aid, reporting on all our grants, this program was designed to integrate with the state aid system. So in terms of, reporting in and out of state aid, pulling from EHIPs and whatever, that's all good. As I mentioned, the Progresso, which is what our nurses are using, which is kind of scary right now because it's unsupported. We're gonna, as soon as we can implement this, we're gonna abandon Progresso. So again, my understanding, and I'm not a tech guy, but my understanding is that this can be used across the board for anybody who has to report time and effort.
There was also, Kelly, a letter that Jack provided that was from McGinnis that stated it was a sole source, which we'll need it for General Municipal Law 103, because we didn't have to go out for bid for this because of that issue with sole source that Schenectady County was using it. So Kelly, make sure that letter is in with this resolution, please.
It's right there.
There it is.
So Jack, we're not presently using this system, correct? And when we do, if we do, what's the learning curve on something like this?
Well, we do have a experience with McGinnis. We brought in a software program a number of years ago that we actually went down a position because we paid the $50,000 for the software and it was able to do the work of a person. Again, I think that once we get this in place, because this tracking time for the grants takes a lot of time. And I think that as we move forward, I do have a couple of people who are talking retirement in the next year or two within my fiscal department. I can conceive of us being able to reduce the size of our department, and in part because of this, and not necessarily go with as many bookkeepers as I have now.
Any other questions for Jack?
Just one more. If this is a software purchase, is there an additional annual maintenance fee associated with the software?
Yes, it's I believe it's something like $8,500 a month, $8,500 a year, and we're paying Progressa on an annual maintenance fee. So this is going to be about $3,000 more than the Progressa was. But again, Progressa was only doing the nurses. This one will do environmental health as well as the nurses.
So we'd have to come up with we'd come up with a prorated share of the $8,500 for this year and then a full year for next year.
Yeah, Jack, I think it's 5,500. That's what I got in your budget for next year for increased maintenance costs.
Okay. So
And Ron, you think the maintenance fee as well could be put through the grants?
Yes.
Okay.
Thank you.
Yeah, I just have a comment. I don't really feel like I don't really know what Jack needs and feel like I can't vote on something that he really clearly understands more than I do. So, I mean, I find this very complicated and software is endlessly confusing and sometimes very expensive. So I think somebody else with more expertise has to make a decision on this one.
Well, I would say in response to that, Linda, in my time here in 13 years, I've watched a dramatic increase, and I'm going to bet Dan's there as well. Dramatic increase in the detail that the state health department in our case wants time and effort reported in. It's gone up dramatically, and then EHIPS debuted within the first year or two that I was here, and I've been here long enough for it to become obsolete. And I understand what you're saying, and when you look at something that tracks time and effort, I would never imagine it back in 2009, 2010. But when it comes to reporting grants, retirement on grants, they've gotten so much more nitpicky when it comes to drilling down into what the time, how the time is spent and whatever. And I only see it getting worse on that.
I agree with that. He's got a lot of grants in the health department we have. And we're not the only county doing that. You see by the other letter, there's other counties that have already implemented the software. It's working very well.
Mike, we can't hear you. I think Mike Chimides has a question, Supervisor Chimides.
It's a zero phone.
Can you hear me?
Go ahead.
Okay, thanks. Has MIS been involved
Yeah.
with the selection of this?
Yes, we actually met with them pretty close to a year ago. They came in, we had a presentation from McGinnis on the software. They did their computer talk in terms of integration and how it worked with the county system, and Rick and Ryan went out of there very pleased that they felt very comfortable that this would integrate fully with our computer system.
Okay. And then do we also talk with HR? It seems like we have a couple different softwares that track employees' time, right? So is there any sort of attempt to sort of make sure that we're doing this sort of across our different departments in an efficient way? And is HR involved with that?
No, actually, I think that my reaction would be that, I mean, this is all about grant reporting, time and grants. HR and Kronos reports time for payroll. I don't know how the two would work together. We never got.
I don't see any integration there.
Ron, could you,
Kelly, you're gonna have to mute everybody until they're speaking, otherwise you can't hear everything.
Yeah, it seems like the feedback, unfortunately, is coming from my, Supervisor Chimides, sorry.
Ron, in terms of Kronos and this program, that you don't see it integrating?
No, I don't see any integration. It's very different from software platforms and everything like that. Not at all uniquely uniform for each department.
Okay.
Michael, did you have any other questions? Thank you. Anybody else?
Okay, so we don't have a motion or anything
Need a
on this.
motion if we're going to approve this, does anybody want to make that motion?
I'll make the motion, Jerry.
Second?
Second, Sterling.
All in favor?
Aye.
Aye.
Opposed? So carried.
I'm not opposed. I just abstained because I really don't feel like I understand. I don't really have the expertise to weigh in on this, so I just want to abstain on this one. Thanks.
Okay.
Got it. Thank you.
Thank you, Supervisor Muskin.
Thank you. Okay, so I think I've been reporting through my monthly report that rabies vaccine we've used a lot this summer. We've had a couple of months in a row where we've had 10 or 11 people going through treatment. A lot of that has to do with the extremely warm weather where the bats come down from the attic into living spaces. And if the protocol is if there's an exposure, they have to go through the shots. And if the bat in the sleeping quarters, that's part of the protocol. So we spent a lot of money on rabies vaccine. This is just moving funds to be able to buy more to finish out the rest of the season.
Does this obviate with colder weather, or does it continue indefinitely?
Well, it will drop off, but we do get rabies cases in November, December. We'll see a big drop off with October.
So what you're asking is to transfer funds from the community health worker to the rabies vaccine account?
Yeah.
Okay.
I'll make the motion.
I'll
Second.
second it.
Supervisor Morel?
Yep.
All in favor?
Aye.
Aye.
Opposed? So carried.
So, in response to what, the question about our two new positives, this is the story of Columbia County, partly the story of Columbia County. This is a family that lives in Long Island with a separate another home up here. They came up. The one is a student from SUNY Oswego who chose to come home, and the father is actually an inpatient at CMH. So we do have somebody who's positive at CMH who is hospitalized as a result of the COVID. So those are our two new cases. As of today, we went that whole 8 days without cases, but now we have some. I don't know if there's any questions on my monthly report. I can answer.
I got one about the rabies. You talked about testing your staff for titers. Does that mean like antibodies for rabies?
Yeah, so before you can handle a rabies specimen, you have to get 2 pre-exposure treatment shots. And that builds up a titer in your bloodstream so that if you are exposed as you handle a specimen, then you only have to get 2 post-exposure shots. So all of us who have been vaccinated, if you will, against rabies, pre-exposure treatment, every 2 years have to get tested to see where our titer is.
Any other questions for Jack?
I have a question about the flu clinics. I see that we have 6 scheduled. Thank you very much for that. How many do we normally do in a typical fall, and how does this compare to that?
Well, historically, we've done many more smaller clinics in different spots. We were told, we were instructed by state health that we needed to use our flu shot effort in a clinic form, a drive-up clinic form, to essentially practice for vaccine for COVID. So we set up this structure, but this is far fewer. I will tell you that the first one is set for Rojan. We actually closed that clinic because we hit 100. So I think that there's a good response out there to it. Some of the other clinics, they'll fill in. They always fill in as the weeks and days progress. We are going to do some additional clinics well, we always do one at DSS because there's a lot of workers there and whatever. We will have one in this building for anybody in the building who wants a shot, any staff in this building who wants a shot. But these are bigger clinics, but there's fewer of them.
Will we be able to serve as many people?
Yes, we will. I see the other ones filling in, but not necessarily filling into the 100. We historically, our biggest clinic, if you will, has been the Golden Gathering at the college in October. And if you go back in time, even just 3-4 years, we did 400 or 500 shots. Last year, we did 276 shots. And that's about the pharmacies being able to give them out. I was talking to one of the pharmacy techs at Walgreens today. They've gone through 500 of their shots. They've exhausted their supply for senior citizens, and they have to reorder. So I think because there are more places for people to get shots, we're doing fewer and fewer every year.
So the line I had my shot this weekend, and the line Friday, Saturday, and Sunday at any given time at Walgreens in Chatham was 10 people. So I mean, they were lined up to get their shots. People are taking it seriously. But do you think so? Anybody that signs up, there's no ceiling. If you sign up for a clinic in New Lebanon, you'll be taken that day.
Yeah, I can tell you, New Lebanon won't hit the 100. We've never done this before in this manner, so we set the 100 for Rojan because we just want to make sure it's manageable for us. But if we can do more than 100, we'll gladly do more than 100. And anybody who wants a shot through the health department, we will give them a shot. If we have to schedule additional clinics, we will.
I just don't know how it was coordinated before, but I know with our senior lunch program, most of our seniors got their shots through the senior lunch program.
Yes.
So we're now redirecting them to the New Lebanon Clinic. And I just want to make sure that they will be, is it by appointment only?
Well, we want them to call ahead of time to set them up.
Okay.
But I'm very certain that anybody who goes to that clinic will get a shot.
Thank you.
Any other questions? Thank you, Jack.
Thank you.
Mental health, Dan?
Hey, yes, good afternoon. Thank you, Rob. Hi, everybody. So we'll start with the overtime report. As you can see, our starting overtime budget is 15,000. Year to date, we've spent $693.47, which leaves 14,306.53 as a remaining balance. So I think we're looking pretty good in terms of our overtime budget. So this resolution, this general resolution, has to do with Parsons Child and Family Center. This is a local provider that has asked us to enter into memorandum of understanding between the Department of Human Services as well as Parsons Children and Family Center. It's just to memorialize that we're going to continue to refer back and forth to one another, and that's really all there is to it. But it's going to be memorialized in the form of an MOU and requires a resolution.
Any questions for Dan on that? A motion to approve?
Motion, Sterling.
Second, Eldridge.
All in
Thank
favor?
you.
Aye.
So carried.
So this resolution has to do with monies that we received from the state in terms of a cost of living allocation. This money is going to be passed on by us to the providers that it's intended for the direct service workers.
There's an annual resolution on the COLA.
Yes.
I'll make a motion.
Second.
All in favor?
Aye.
Aye.
Opposed? So carried.
And this is the last of the general resolutions. It mentions a health insurance company that we would like to contract with so that we can serve their members. Nescentia Health Plus is the name there. You see it on the resolution. So they would like us to serve their members. I'm not exactly sure in terms of how many members they represent, cover in Columbia County, but if we can serve their members and get a substantial reimbursement, I'm all for it.
Questions for Dan on this? Motion to approve?
I'll move it.
Second, Drury.
All in favor?
Aye.
Aye. Opposed? So carried.
Thank you. So this one is a bit more, this is our one personnel request. I must have jinxed myself when I spoke with all of you a month ago at that Health and Human Services Committee, because I spoke of the concern that I have about any one of a number of staff submitting a retirement request or their requirement, their retirement notice. So in fact, that came to fruition. We have a gentleman that's been with us for 30 plus years. And shortly after last month's meeting, he informed me that he intended to retire. His last day, I believe, is going to be September, yeah, it's right there, September 25th. It's a unique situation because he currently carries the title of Senior Psychiatric Social Worker. Normally, an individual in that title is acting in a supervisory capacity. In this case, and this goes back in terms of historical information way before my time, this individual, instead of working as a supervisor under this title, worked primarily as a clinician and carried a caseload. So some of you may remember back in 2018, we did some restructuring with the senior psychiatric social worker title, and an agreement was made that was memorialized in an MOU that when this individual either leaves the county in terms of leaving their employment with the county or retires, we would agree to abolish that fourth senior psychiatric social worker position. And that is what we are asking for. We want to abolish, we want to be in compliance with that MOU and abolish his title. However, because of the need that still remains in his absence, which is quite significant, this individual carries a caseload of 92 cases at the moment. That will be slightly reduced as he discharges some people, but nevertheless, the number will still be very significant. So we want to create and fill a clinical position in the form of either a senior behavioral health social worker or a behavioral health social worker. Now, if I may, I'd just like to remind everybody the senior behavioral health social worker would be a candidate that carries a LCSW, as opposed to the behavioral health social worker, the lower grade. That is someone that is just a licensed master's level social worker. The primary difference is the LCSW is required to treat individuals with Medicare, and some managed care companies require it as well. The individual that is leaving, that is retiring, is an LCSW. He has just under 20 cases that require the LCSW. So we will aim, if this is approved, to hire a senior behavioral health social worker who will be an LCSW, so that we can more easily move those cases over to an incoming LCSW. But we never know what the advertisements will yield in terms of candidates. And as far as financial impact to the county, I just want to reassure everyone that in this case, because of the reduction in in grade, we're looking at a savings. If we fill the vacancy with a senior behavioral health social worker, we're looking at approximately 23,000. If it's with a behavioral health social worker, we're looking at $25,000 of savings.
And that doesn't include the billing that this person would be able to do?
No, that doesn't include. That's just their salary. So yes, on top of that, there would be the reimbursement that they would generate. And as we've discussed previously, I believe as early as last month, our social workers, our clinical staff exceed their costs, their salary and their fringe costs by the amount of revenue they're able to generate.
Any questions, Dan, on this?
When you talked about the savings, Dan, did you also include the fact that the new employee, we wouldn't be paying longevity to?
Right. Thank you, Matt. Yeah, there's that to consider as well. This individual who's leaving with the 30 plus years certainly has longevity. Yeah, I think there it is. Kelly just highlighted the breakdown.
Okay, so it's included.
They would be coming in at a step one as well. So there's significant advantages in this case. The realities are, and I know I just came to you not long ago asking to fill a position, but no one could have expected that we were going to be hit with a retirement as quickly as we were. By the way, I do have a candidate who is starting next week at the clinic, who is going to be filling the vacancy that all of you approved last month. So we're very excited about her coming on board. But we could experience another retirement. We have one staff member that has a caseload of 70 plus who's going out on maternity leave in November. There's still a significant need for our department.
Brenda?
Can you tell me what the wait time is for care at the current time?
Yes. I'll do my best to answer that as specifically as I can, but there is a wait. We do have a wait list. The wait list is approximately, now it's grown to probably well over 70 individuals, because our ability to take people off the wait list has been compromised by all of the positions that we have not filled. Also, we're under a regulatory obligation to offer appointments to people coming out of the hospital, so they take priority. And we are receiving so many of those requests from the hospital that we are not have not yet been able to, with regularity, take people off of the wait list. So to answer your question specifically, we're doing our best, but we have people going as far back as April who have been on the wait list. And I could explain a bit further if you'd like me to. There's a triage element as well, where we triage individuals as a number one, number two, or number three, depending on their acuity. And the number ones are the individuals who we attempt to get to as quickly as we can. Twos and threes would likely be on the wait list longer than a one, let's just say. So there's that factor as well. If you're a three, that means your acuity is relatively low, that you're a person that can wait on the wait list longer than a two or a one. Now, we do have our peer specialist. That's a position that we have. And that person is reaching out regularly to everyone on the wait list just to stay connected, to check in with them, to assess them and make sure that their acuity has not changed as a result of having to wait. We have had instances where a person's been a three when they got on the wait list, but as a result of the conversation that they've had with the peer specialist, it's evident that they are now one, and we do our best to get them in as quickly as possible.
Dan, it's possible that a three could be on the wait list almost forever based on the situation.
Unfortunately, yes, Rob. Hopefully not forever. Hopefully,
But I mean, for a very extended period of time.
yes, that is true.
And I have a question. It's Kathy Eldridge.
Hi,
How
Kathy.
many, how are you? How
Good.
many of the ones end up in the hospital? You know what I mean? Is there a
yeah, I
significant
do.
amount that end up in the hospital that then would get put on the list? I mean,
Anecdotally, I don't know of any. If I understand your question correctly, what you're asking is how many of the folks that we identified as a number one and
correct?
then had to put on the wait list for any amount of time ended up in the hospital getting rehospitalized, or I should say hospitalized between the time they ended up on our wait list and the time we were able to offer them an appointment. Is that what
Yes,
you're asking?
that's the
Right.
question.
At this point, I don't know of any.
Okay, well, that's good.
None have been reported to me. It may likely have happened because these are individuals, like I said, who are presenting with, in a chronic way, having chronic conditions, mental health, medical, substance abuse, and who are in acute distress. But unfortunately, we just don't have the capacity. You may remember, Kathy, and those of you that were with us last month, I talked about all of the clinicians' caseloads are 80 or 85 clients and above. The availability that they have is being consumed by the hospital discharges. That is a regulatory obligation. We have to give those hospital discharges an appointment to be seen within 7 days, 7 calendar days. So, between that and having to absorb the caseload of departing staff, it's been a challenge.
Dan, if I could, Mr. Chairman, I know last month I got the impression that with the positions that we approved, that you would be able to significantly impact that waiting list.
Right. So let me speak to that.
So those positions we approve, plus if we approve this position, that wait list should go down significantly?
Yes, Matt, I'm sorry, excuse me, Chairman. Yes, Chairman. As long as I don't get another resignation or
Okay.
a retirement. What
Well, we'll
happened,
cross that bridge when we come to it.
right, but I just want everybody on the call to understand what negatively impacted our ability to make a dent in the wait list is a couple of things. I needed to first identify the candidate, vet
Mhm.
them, and onboard them. So that candidate is due to start on Monday for the position that you approved last month. So she is about to begin. Now, I want to be humane about this. I don't want to just, assign her an inordinate amount of cases. She has to acclimate to the department. There's a learning curve, et cetera, et cetera. So over a period of time, yes, the plan was to integrate her into absorbing the wait list, as well as maybe go out to the college or identify another staff person to meet that need, because the college had also been asking for us to serve them in the way that we had previously. But then along came this retirement notice. So what I'm going to have to do is use this new hire to absorb some of the 92 cases that this individual who's retiring is going to leave behind.
What you're saying, Dan, is that when the three individuals, if we approve this, would be the third, when they're operating at 100%, at that point, you would see a significant decline in the wait list.
Yes, absolutely. And just a minor
That's
correction,
gonna
Rob.
take a while for us to get to that point.
Well, it could, you know, we're a resilient bunch. We've persevered through a lot, and the staff have been amazing. So it will hopefully be sooner than later. Just a slight correction though, Rob. It's not 3. I know you approved, if you approve this request, it'll be 3 positions. But please keep in mind, last month, one of those positions was a behavioral health care coordinator. Now, John Lyons has not yet been able to identify and secure a candidate. It is when he secures a candidate and they come on board that he will be able to release the individual who, as far back as March, was supposed to come to the clinic from his team. She has not yet landed with the clinic because he has needed her, and he can't release her to the clinic until he finds a candidate. And I'm talking with him almost daily about his efforts and his progress with that.
Okay.
I have one more question, please. Have we heard from the school districts? I know that a lot of them, with the budget reductions, are losing counselors, mental health counselors, or guidance counselors, or any kind of support for students. Have you had any specific conversations with school superintendents about their needs and what, if any, gaps you could fill?
I'd like to answer that, but if I could, and I don't know if this is appropriate for me to say, can I get a decision on this? Because I also asked to be on the agenda to talk about revisiting me talking and approaching the schools, as well as providing face-to-face services at Valatia Medical Arts. Those were things that the home committee had asked me to bring back in September. So I'd like to discuss that. But do you want me to answer that now, or do we want to make a decision on this resolution?
Well, it seems to me that you've demonstrated more than adequate need for the position, but in the event that there were additional need from the school district, it would put additional pressure on making this decision.
Okay.
I was blending the two, but I'm
Right,
happy
thank
to
you.
wait till later.
So yes, I would like at this point to approach the school districts, all 6 of them, and inquire from them as to how they are feeling about helping make us whole, because that was the request earlier this year. We had approached them, my predecessor, Michael Cole, had approached them and invited them to participate in meeting our financial expenses, our financial cost, I believe at a rate of 50% at 7 hours. None of them were interested in accepting that request. So we figured, okay, let's give it till September. However, in the meantime, COVID has happened. So I don't know the state of their school budgets. I don't know what types of monies they may have, but I would certainly like to approach them. I know the superintendent of Ichabod Crade there's a new superintendent. She reached out to me and said that, you know, she's very much interested in working with us because she understands the needs of her student body and knows that they have significant behavioral health needs. Chatham District has always been a very strong champion of our behavioral health services, and I believe would be interested in partnering with us. As for the remaining 4 districts, I don't know. I would have to speak to them and revisit the conversation and see where they're at. But the students that we were serving in the schools, those students are still being served by us. They're just being served either at the Hudson Clinic or now at the Valatia Clinic through tele and video services.
Okay.
I think the schools are all waiting to come back and see how it goes with their opening and what they're doing. They're just on their second week, and then don't even have all the students coming in and going out and learning. So I think the school thing we should look at, Dan, and knowing Ichabod and so forth, I think you should give them all a month till next month, and then really reach out and see how it all goes with them. They're going through a lot right now, and I think
I
it's
agree
only
with you,
fair.
Patsy. Yeah, I agree with you, Patsy, most
Yeah.
definitely. So what I was looking for tonight is just basically the go-ahead, so that at some point I could approach them. But I wasn't intending to call them tomorrow because I know they're completely overwhelmed and just struggling to figure out what to do next. So I was thinking, you know, actually in a month or two, maybe picking up the phone and starting to inquire with them as to what their level of interest was, if at all, and encourage them to do some brainstorming on their part about how they might be able to find monies to partner with us.
Yeah, and I was thinking that we should have a little more of a plan going to them, because I'm not sure what the specific plan was in the past and how aggressively, or even, how that was even followed through on. I'm not sure what the plan is. Is it 50% that we're looking for? Is it 25%? Is it zero? Is it 100%? I'm not sure exactly what that is. And I think we really kind of have to know that before we approach them. And maybe it's first a vetting process to find out if there's even an interest and a need, and then
Right.
come up with what the county or that your department can do. But I think in the past it's sort of been done, maybe not as clear cut as I'd like to see it done, so we kind of have a better understanding.
Well, I'm happy to do that, Chairman Ligonia. I do know that it was, the ask was 50% of the time, of the cost associated with 7 hours. So I believe that's memorialized somewhere. I can probably put my finger on it so that I can share it with you. But that was something that Michael Cole had spear fronted and was involved in. So at the time, I wasn't as intimately involved with it, but I'm sure I can retrieve it and we can go over it if you would like.
And the other question I would have is because it's my understanding that when we were in the school districts, we were not seeing that many students. And I don't know what those numbers are specifically, and I don't know if we have that data, but that would be helpful, I think, to see that, how many days, how many hours we were in the school districts, how many students we saw.
Right.
There may be, there may be a need. They think that there may be a need, but maybe there isn't. I don't know that answer, but
Well,
that was
if
one
I
question
may,
that was brought up at the productivity committee, Chairman, in terms of the number of students that mental health was seeing. And I believe we had asked Michael at the time to get us those numbers. I don't believe we got them, and I'm not, a lot of things happened between the last meeting we had and now with COVID, and a lot of things got sidetracked. So
Yep.
if I may, I can speak to that. What I would say is, I don't have the data, of course, with regard to the number of visits and so on and so forth per district. But what often happened, and this is what led us to ask the districts to contribute, is that, we are present in the school under our current operating certificate through the New York State Office of Mental Health, which allows us to provide clinically reimbursable services in the form of individual psychotherapy, group psychotherapy, things like that. So it's very, very specific. What the schools were doing is they were coming to us with wishes and wants and desires that fell outside of that. So, for example, they wanted us to participate in uh, the EAP type meetings, or participate in an assembly, or a parent-teacher conference, or intervene with a child in crisis, or provide a prevention type lesson to a classroom. And those are things that uh, we could do. We certainly had the skills to do, but we wouldn't be reimbursed for those under our license. So our lens was very narrow, and the school's needs were much broader. So we said to them, listen, we would be happy to oblige those needs if you contributed financially, because otherwise we're having to absorb all of those costs. If our social worker is participating in a parent-teacher conference, then they're not providing a billable service in the form of a psychotherapy session or a group counseling session. So
But I think
that's part of it.
before I ask another question, I want to move, if it's okay, Rob, I'd like to move this resolution so that Dan can relax a little bit and know that it's coming. So,
Thank you.
but the other thing is, I think that we may have found that the mental health needs may have shifted dramatically in the last 6 months, with different kinds of support being required because kids were out of school for so long, and because of the stress associated between either remote or hybrid or who knows what kind of learning over the next 6 months. So maybe we could do some sort of a survey and or a menu so that schools understood what the value added would be if they want those items from the other list, that they're available, but how to pay for them and what the contribution would be. So they could do a return on investment analysis.
That's a good
I didn't say
point.
that very clearly, but I think I hope you know what I mean.
I certainly do. And Michael had created such a menu and had proposed that to, I'd have to verify if he actually presented it to the districts or not. But yes, there was a creation of a menu with, dollar values associated with each item so that the schools could assess or project their costs in some way, shape, or form.
But what I'm hearing from parents and teachers is that behavioral issues are much more prevalent now than they were a year ago. And that the staff doesn't always feel that they have the skill set to manage those issues. So I'm thinking that you might have a greater value added in this context than you would have a year ago.
If I could I say something? So, public schools throughout the United States, but specifically in New York State, because that's my experience, are required under federal and state law to provide services to children who are identified to receive those services regardless of cost. So they're not cutting back on behavioral specialists or psychologists. They have to have those people in the building for the children who have been identified. What the county is doing, or has done in the past, is said, we have this additional service that we can bring. And instead of children who would ordinarily have to travel to Hudson to get therapy, they were bringing the therapy to the schools in order to do that. But what Dan is talking about, and I know what Michael was talking about before when he was here, is that the schools are saying, okay, we can use you over here. So ultimately what's happening is county taxpayers are paying for something that the schools are requesting that's beyond what the county was looking to do, which is bring the therapy to the kids at the school buildings. That's really what we're looking at here. And if they want to do more, well, then, there's a cost to it. But under no circumstances, unless the laws have changed in the last 3 years, and I don't think they have, under no circumstances is a child who's identified, who has special education needs or a 504 program, under no circumstances are those children not getting them because it is against the law for the district to cut back on those expenses. They can't do it.
Thank you, Supervisor. Any more questions for Dan, or is there a motion to approve this resolution in front of us?
We have a motion by Brenda.
We have a
And I
second.
second.
Supervisor Eldridge, all in favor?
Aye.
Opposed? So carried.
Very much appreciate that. Thank you.
You're welcome. Are there any more? I guess, Dan, what I would suggest is we have a little more time, as we've discussed here, to give the schools a little more time, maybe for you to give a little more thought to how we would approach them, bring it back to committee next month, and maybe we could put a better plan in place and then move forward with it at that point.
That's fine, Chairman. Thank you. I appreciate that. And there's not a real urgency, but I just I agree that they might be more likely to given all of the unique needs that the students are having as a result of the pandemic and being at home as much as they are throughout the summer and now the school year. The final
have some schools that are, some schools are not going in much. Some are going in almost every day. New Lebanon's every day except Wednesdays. I know other schools, I think Taconic's in every day. Some other schools are not in that often. So it's sort of been, to me, it would be a tremendous challenge just to try to figure all of that out. But
which makes sense to wait because more of them will have increased their on-site learning by October or November, I hope.
Yeah. Okay, anything else, Dan?
The last thing was just asking for support for us to move in the direction of reopening our Volusia Medical Arts satellite to face-to-face services. That was something that we stopped doing as a result of the pandemic as a result of our departmental operations. And since the 100% return, we have staff that are reporting to the satellite at Volusia Medical Arts Building. And once we have some of the staff return from the FFCRA accommodations that were approved, we'll be able to have the minimum staffing in place to offer face-to-face on a very, controlled level. But I'd like that option. I'd like to have that option available to me.
I mean, speaking for the group, but for me, I would be fine with that. But I would want to make sure that you spoke to Brian and that we were doing exactly the same signage, exactly the same protocols that we're doing in the county, so that we're following the same thing, whether it's a county building or it's Volusia Medical Arts.
Yeah, not a problem. We have been working with facilities, so all of the signage, the sanitizing stations, the reduction of the capacity in the waiting area has all been memorialized in our reopening plan, and we are practicing that. Facilities has been wonderful. I just need to give them that credit. They created these screens for our staff to act as barriers between the staff and the client. It's just been amazing. And we have 2 of those being built for the VMA so that our staff can utilize them.
Thank you. Supervisor Morel, I thought you were trying to say something.
Well, you actually said exactly what I was going to say, Chairman, so.
Thank you.
So I have a question.
Hey, Dan, Ron C. here.
Hey, Ron.
We paying a monthly rent on Medical Arts VMA anyway?
Say it again, please.
Or are we still paying the monthly rent anyway?
Yes.
We were, weren't we? Yeah.
Yes.
It's like
So,
$3,000 a month.
Yep. So I would like to, as of the 100% return to work, we have staff there and they're providing tele and video sessions, which is generating reimbursement. But I'd like to just expand the options for the clients to include face-to-face because some of them are asking for that. Others, of course, are still very nervous about it. But for those that are interested, I'd like to be able to oblige that request.
That could also potentially help out Ichabod Crane School too. It's just down the road from there. So
yes.
So I have a question. Dan, sounds like you're understaffed.
That's correct.
So is there any way can the county help make that change?
Well, the county, in my opinion, thank you, Linda, I really appreciate that. As far as I'm concerned, the county has been very generous with approving our previous 2 resolution requests and now today this latest resolution request. I would like, because I'm also very cognizant of the situation that the county is in. I'm well aware of it. I viewed the full board from the other night, and I would, at this point, be okay with us just seeing what we can do by hiring the staff that we've been approved to hire and seeing what kind of effect that will have on the wait list, on covering our needs. Sure, I would love it if all of our vacancies, because we do have an additional 3 clinical vacancies that have not been filled, but that's up to this committee and all of you if you want to discuss supporting the Department of Human Services in a much more substantial way.
I will say over the last 2 or 3 months, we've approved 5 positions, including the one today. 2 clerical, which there was a need, and now 3 clinical. Obviously, it's a net gain of 4 because this is replacing a retiree. But I think, again, based on what Dan had said, this should take care of most of the backlog. I'm getting pretty good at reminding people that this year we're looking at a $10 million budget deficit, and next year's not looking much better. So, I hate to be the person to rain on people's parade, but it's pretty bleak. And I think Ron and PJ could attest to that. But we're, based on the fact that, Dan has made a very good case, I think we're moving in the right direction, and I think we just need to take baby steps as we move forward. And
I have advocated for their department, and I've advocated to Chairman Morel, I've advocated to the Budget Committee, and they've been very receptive. So they have worked, and they have, against what I think at times that they'd like to do financially, but they realize that there is a need, and they've stepped up. So I want to thank them as well. So hopefully things will turn around, and hopefully we can fully staff everybody. But we do have, as Chairman said, a financial, uphill battle ahead of us. So let's start with that and see where it goes.
But I'd like to say to Supervisor Mussman, I'm deeply touched by your advocacy. It means a lot to me, but um, I'm also trying to be very cognizant as a department head and as the Director of Community Services interim of the situation, the financial situation that the county is in. So I'm going to do the best with what I've been approved for. And don't worry, I'm not going to be afraid to come back and explain myself if I need to ask for more.
Thank you, Dan. Are there any other questions for Dan?
I have one more question, and Dan, I hope you'll pardon the fact that I'm a new supervisor, and this may be knowledge that's held by everybody else. What are we thinking about in terms of the needs of our seniors? I know the isolation has worn heavily on our senior population, and I'm wondering if there are any things that we can do, proactive things that we can do to improve the mental health of our seniors who continue to be isolated, most of them in their homes.
It's a tough question because as you've heard, we're trying to simply tread water as best we can and work with the existing census that we have, which is slightly over 1,000 people, many of which are, and I want to choose my words carefully, are of the aged age group, let's just say. I think our average age for the 1,000 or so people that we treat is 35 or 40 years old. And I don't know the percentage that is 65 or older, but there are quite a few. In terms of out of the box ideas and thoughts, I would be happy to maybe reach out to the Office of the Aging and kind of collaborate with them as far as what they're seeing as are some of the needs, and hear from them as to what we might be able to do as the mental health center to improve outreach and engagement to those that are isolated as a result of the pandemic. But to be honest, you've heard our ability to take people off of the wait list, and those are individuals that have contacted us proactively seeking services has been stymied. So for us to, pursue and do outreach to yet to be identified or anonymous individuals, in this case, seniors, I'm sorry, that has not been done.
Well, I just, for your information, our 49% of our county is 65 or older, and many of them are still not going out to food shop or even to go to a doctor. And what we started to see, we're making local community efforts to address those issues, but we're starting to see some real deterioration, mental deterioration associated with that isolation. So I don't, maybe I can talk to OFA and see what, if anything, they're doing. And, but I do think that this is going to is going to create a problem down the line. And if
I agree, their isolation, the reduction in terms of, or the pulling back, the retraction of service providers that they previously had a connection with, that being reduced and pulling back will definitely have a cumulative effect and not the sort that is desired or wanted. I'd be open to a conversation. So if you have ideas, if you would like me to reach out to OFA to talk to their department head, I'd be happy to do that.
And Matt, I'll look for money to pay for it. How's that?
Well, that would be helpful because I don't want to take up too much time, but the tricky part of doing off-site services is that you are taking that clinical person and putting them in a county vehicle and then sending them X number of minutes in one direction. Now, granted, the aged population that's isolating in their home, they're a captive audience, so they're likely to be there when you arrive. So it's not like you're going to get a no-show. But the only thing you can bill for is the actual service that you're providing. So if you're doing a 45-minute session, which through Medicaid or Medicare, we get reimbursed at around $140, maybe a little bit more. Yes, it's a little bit more than that. I believe $168. But you have to pay that staff to travel 30 minutes one way, a total of 60 minutes at their salary. It gets tricky because that is an expense that has to be weighed against the revenue that you just collected.
So
And
we
that,
might be able to do something with telemedicine.
absolutely, yes. If
That would,
the senior is savvy with the software and has the hardware, which many seniors do, which is a wonderful thing. But yes, there's a learning curve. We're running into that with our existing clients in terms of there's a lot of education and tutorial that we have to do for them to get them up to speed to offer these video sessions that we're conducting.
Brenda, the only thing I'd like to say too is that I think you should talk to Kevin McDonald. I mean, they do have caseworkers on staff that are dealing with a caseload. They also are, as I understand it, are starting to open their satellite centers so that the seniors, because the seniors are chomping at the bit to get back to see other seniors. So I know we just approved one in Livingston and one in Valatia, yes. So, I mean, they are starting to get back into a normal, business. But Kevin, I think, can answer some of your questions. And I know he has 2 or 3 caseworkers on staff.
thank you.
Yep.
Anything else for Dan? Thank you, Dan.
Okay, thank you. Good evening, everybody. Take care.
Hi, Dan.
Bye-bye.
Do we have anything else, Kelly?
I believe that's it, Chairman.
All right. Anybody else have any other questions? If not, I'll take a motion.
Motion to adjourn.
Second.
Second.
All in favor?
Aye.
Opposed? No carried. Thank you, everybody.